why. But let's first go to Geneva in Switzerland, where World Health Organization is holding a news briefing on the coronavirus outbreak.
Clearly we want people who are sick, especially those with coughs and difficulty breathing, to seek healthcare as soon as possible. During our trip to China, we were very impressed with the level of engagement of the Chinese government at all levels. Personally, I think myself and the Director General have never seen the scale, commitment of an epidemic response at this level, in terms of all of government involvement across all of the different arms of government, with tremendous support being poured in.
That's Dr. Michael Ryan. He's the Executive Director of WHO, briefing the press about the coronavirus outbreak. Let's listen in a bit more.
Has been massive, and the Chinese government deserve huge credit for that response and for the transparency in which they have dealt with this. A case in point, in terms of one of the clusters of infection that we're currently working with Germany to investigate, it was the lab in China who contacted Germany to tell them that they had a return case who was positive. So China is not only helping to manage the cases in its own country, but it is actively reaching out on an individual basis, not only to WHO, but to other partners in the world, to help them respond in a more effective way. As I said, they are taking extraordinary measures in the face of what is an extraordinary challenge. They have, in addition, have agreed to a mission of international experts to go to China and work with Chinese experts to better understand disease transmission, to better understand clinical severity. But I might add that Chinese experts are involved in almost, I think, all of our expert networks, and on a daily basis dialing into calls on the clinical, laboratory and other aspects of this. So Chinese expertise and scientific knowledge and understanding of this disease is contributing to the overall global expertise. But we're very grateful that China will invite a team to help work with them side by side to learn more about this disease and learn more about how China is taking action. On our side, we have brought together some of the best minds in the world: scientists, clinicians, disease trackers, modelers, logisticians, supply chain experts, and many others from the public and the private sector around the world, to examine what we know, the questions we need to answer, and who is best placed to deliver on those answers and those responses. As I said, these networks of experts include experts from China working directly on the response, and that frontline experience, understanding what a frontline clinician in Wuhan is seeing today, is influencing the way in which we can manage.
That's Dr. Michael Ryan, Executive Director of WHO's Health Emergencies Program, and he was explaining that they're quite grateful that China has been cooperative. It's helping other countries deal with the spread, in how the patients are being treated, in how infected people are being flown out of China, and that China has also agreed to work with international experts, that experts from China are already in touch with WHO. So some really positive observations being shared in that press briefing by the World Health Organization. And I'm being joined now by our China media analyst, Kerry Allen, helping us through the story over the past few weeks. And Kerry, you were listening in to that. The focus really has been on how other countries now, as the virus spreads out of China, are tackling with this growing threat. What do we know is being done?
Well, we know that increasingly a number of countries are sending tens of thousands or even hundreds of thousands of medical supplies. So we know the US, for example, has sent millions of supplies. Japan as well sent 10,000 surgical masks. South Korea has sent millions. Singapore is increasingly sending products as well. So we know that a number of countries are helping Wuhan and wider China to get supplies themselves. But also there was some initial reaction in the morning in China towards the WHO, saying that an international team would be going to China to learn more about the virus and provide guidance. And we have to remember that China has dealt with epidemics before, so like SARS and before that, back at the much earlier, there was an outbreak of the pneumonic plague in the north of China, and there is a real kind of, China likes to give transparency then, so yeah, it'll be very positive and very encouraging for them to see that the World Health Organization is saying that China has been so transparent, and that is exactly what I'm seeing online as well, and in official media. A lot of detail that's coming out of international cases. So today we know, for example, Chinese people will be reading about the UAE having its first confirmed case. So people are reading about the international cases as much as what's happening on the ground. And we think, for example, of just the case in Wuhan, a city in lockdown. People can watch on a live stream one of these hospitals that's 25,000 square meters and is going to be built in a week, just over a week. People can watch that on a live stream, so they're seeing transparency within a city in lockdown, and they do feel encouraged by what the government is doing.
And what is happening in that city in lockdown? We were hearing a lot of videos being shared on social media which were positive about, the city will fight this. What have you been seeing being shared now?
Not much more beyond this today. So again, a lot of interviews with medical professionals who are, the official media have been trying to get interviews with people who are basically working around the clock to try and help in this virus, and they're very upset. They've been crying and saying they miss their family. Outside of Wuhan, we've been seeing increasingly very unusual videos of drones arriving in rural villages, encouraging people not to go out if they've not got face masks. So there was one video that was going viral of an old lady in a rural region basically being told by a drone, go back inside if you've got a face mask, or try to stay safe. And everybody's thought, gosh, she looks so cute. She doesn't have a clue what's going on, but she just obeys and walks back to her little home in the countryside.
Well, everyone's trying different things to keep the virus contained. Kerry Allen, thank you so much for joining us with that update.